Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Glad that you could join us again. You know, Parkinson's affects approximately 1 million people here in the United States, and rates are increasing. But it can be a challenging disease to diagnose because the symptoms differ from person to person. Now, April is Parkinson's Awareness Month, so it's a perfect time to learn more about this condition, including what are referred to as off periods. Now, joining us on the program to talk about this very important health topic and why we need to communicate how we're feeling are Dr. Robert Hauser, director at Parkinson's Disease and Movement Disorder Center in Tampa, Florida, and one of his patients, Mr. Bob Harmon. He's living with Parkinson's today. Welcome to the program, both Dr. Hauser and Mr. Harmon. Thank you both for joining us today.
Great. Thank you.
Well, Dr. Hauser, a bit of background about yourself briefly.
I'm professor of neurology at the University of South Florida here in Tampa, and we do a lot of research in Parkinson's disease with patients, trying to assist developing new medications and treatments for Parkinson's disease.
And Bob, just a bit about yourself.
I've been retired. I retired actually the year I was diagnosed 13 years ago. I'm pretty active in the Parkinson's community through our support group and fundraisers and events like that.
Dr. Hauser, what exactly is Parkinson's disease and who is most at risk?
Yeah, Parkinson's disease is a neurologic condition where individuals are losing dopamine neurons. And this chemical messenger in the brain, dopamine, when it goes too low, individuals develop the signs of Parkinson's disease. Parkinson's disease is usually asymmetric. One side tends to be affected first and worst. And we look for slow and small movement, stiffness, tremor, decreased stride length, decreased facial expression, soft voice. Those are the signs of Parkinson's disease. Unfortunately, we're all at risk for Parkinson's disease. The biggest risk factor is age. The older you are, the greater the risk is for Parkinson's disease. In general, if you look at a population age 60, about 1% of individuals have Parkinson's disease. If you go up to a population age 80, about 2% of individuals have Parkinson's disease.
Wow. And Bob, based on what Dr. Hauser has described, would you consider yourself classically symptomatic as far as your diagnosis is concerned? Were you experiencing some, most, or all of those symptoms that Dr. Hauser was talking about?
Most of them. I did not have a very significant tremor, which a lot of people look at Parkinson's and that's what they look at. But all of the other factors I did have.
What was it that led to your diagnosis? Was it something that took over immediately, or was there a time period where things were getting progressively worse?
There was a time period where it got progressively worse. I kept going to my family doctor talking about this condition that I had, and I just wasn't feeling right, and I didn't explain it to him very well, apparently, but he missed it, and I finally asked to go see a neurologist. I went to the neurologist, and he came out of his office, watched me walk towards him and down the hall. And as I walked in the door, he said, "You're here because you have Parkinson's."
Dr. Hauser, what is it about Parkinson's that makes it so hard to diagnose?
Well, as we get older, we tend to slow down. So when a person doesn't have tremor, it's a little harder to diagnose. I would say about 70% of Parkinson patients do have tremor, and that makes it easier to diagnose because tremor is abnormal. But if a person is in that 30% who doesn't have tremor, if it's just slowness, it's a little harder to diagnose.
So how is it generally treated?
Yeah, the medications we have, the baseline treatments, are really designed to boost dopamine in the brain. And initially that works pretty well. Medications last from dose to dose and patients get benefit. But over time, patients find that they fluctuate with regard to their response. They have periods where the symptoms are well controlled, and we call those on periods. But they also have times when the symptoms reemerge or come back, and we call that off periods. So these are times when the tremor, the slow and small movement, the stiffness comes back. So we've been looking for better treatments to treat those off periods.
Are these off periods more frequent for you, Bob, or do you experience them?
I do experience them. They have gotten more frequent or longer in duration over time. I now have 4 distinct times during the day that I'm generally going to be off because of the timing of my medication. So I have expectation that it's going to come, and it does.
Well, Dr. Hauser, as far as the medication, Bob's talking about his timing. Shouldn't it be a matter of just adjusting when the medications are taken, or is it much more complex than that as far as keeping a patient on?
Yeah, it's more complicated than that. Two things are happening. In the brain's ability to convert oral medication to dopamine and have it last a longer time is diminishing. But the other thing that's happening is that the gut is working less well. So to take pills, the pills have to get past the stomach to get absorbed, so it takes longer for them to go through the gut and get up to the brain. So that's why there's been emphasis on non-GI medications. And in fact, what we're here to talk about today, a medication called Inbrija by Accorda. And in fact, I'm excited to be here on behalf of Accorda Therapeutics to talk about this medication.
So why is the approval of this medication such an important factor when we're talking about Parkinson's?
Yeah, so this is an inhaled levodopa medication. And in the clinical trial, what was seen was that patients, when they entered one of these off periods, took the medication, and 30 minutes later, there was a significant improvement in symptoms. And in fact, onset of action was at 10 minutes. So that led to the approval of this medication. Now, like all medications, there are potential side effects, and the most common side effect for this medication was cough. In addition, it's not for everyone. It's contraindicated in patients who are on non-selective monoamine oxidase inhibitors, medications that are uncommonly used today, but some patients are still on them. And it's not recommended for patients with chronic lung disorders like asthma or COPD.
Now, Bob, are you using this treatment now? Are you a candidate for it, a good candidate?
I actually was in the trial that led to the approval and came out of that trial about a year ago. And I'm here to tell you that yesterday was delivered to my house, my prescription for Inbrija.
Right. So what is your motivation? I know that you're in a successful trial and you're managing your Parkinson's now. What's your motivation for doing what it is that you do for the Parkinson's community there in the Tampa area?
Well, I've made the choice to look at everything as positive, to be proactive. I try to put Parkinson's in the back seat of the car. Mm-hmm. It's got to go where I'm going. I'm not going to go where it's going to take me. And that's led me into trying to help people with Parkinson's. We have a support group. We teach Tai Chi. We have boxing, exercise, doing all the things to keep the beast in the back seat.
So what would you tell someone to think about, to do, the questions to ask maybe as soon as they're diagnosed with Parkinson's?
Well, I think they just need to be proactive and go get information. You can get information at the Inbrija.com location. There are other locations that have it. Get yourself educated and talk to your doctor about what's going on.
Dr. Hauser, where can we get some more information in addition to what Bob's given our listeners?
Yeah, there are a number of foundations out there that will provide information and also have websites. So those are also good sources of information.
Dr. Hauser, Bob, it's been a pleasure. Thank you both for joining us here on the program here on Health Professional Radio. Hoping that we'll speak again sometime in the future.
Our pleasure. Thank you.
Thank you.
You've been listening to Health Professional Radio. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. And be sure and visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.